Good afternoon, and welcome to today's webinar titled Protecting Hospital Operations with a Knack for Clinical Networks. My name is David Rath. I'm Senior Editor at Healthcare Innovation. Today's program is brought to you by Aruba, Comport, and Medigate. Thanks to our sponsors and to our audience for giving us your time and attention today. You have a few housekeeping details before we get started. To submit a question, please use the Q&A box to the left of the video window at any time. You don't have to wait until the end of the program. For technical issues, you could please press F5 to refresh, and if that doesn't work, you can submit a question with your issue through the Q&A box. And finally, you can join the webinar on Twitter, tweet using the hashtag HILiveWebinar. And at this time, I'd like to introduce our speakers for today's webinar. We have Eric Krucker, Chief Technology Officer at Comport Consulting, Samuel Hill, the Director of Product Marketing at Medigate, and Ron Kent, the Senior Manager in Business Development at Aruba, which is a Hewlett-Packard enterprise company. So at this point, I'm going to turn it over to Eric to begin the presentation.
Yes, thank you very much. Appreciate everybody being here today. Thanks for joining us. We're here today to talk about IoT security and network security, specifically around medical devices, obviously, and to talk about two great solutions that Comport works with and brings together to bring medical IoT device security to hospitals and care providers around the country. Aruba leads in the Magic Quadrant, Gartner's Magic Quadrant, right? And Medigate, who's a class award winner, right? These two are best of breed solutions. We as Comport don't partner with everyone. We partner with best of breed solutions to bring an entire congruous solution to our customers and help them implement it. A little bit about Comport. So we've been in business since the 80s. I have not been here since the 80s, thankfully. And our business was primarily based on the East Coast. We're a systems integrator and managed service provider. We started in the New York area and moved into Boston, Philadelphia. And a few years back, we started into the central region. So from our roots and sort of our brick and mortar businesses based in those regions. And we do things like hybrid IT, networking and security, cloud, and both public cloud, private cloud, and managed and hosted services. Within Comport, we have basically three brands within our Comport family. Comport Technology Solutions, which primarily deals with data center to edge hybrid types of solutions that are really focused on premise. But most of the solutions today have a big component that is either in a public cloud or in a private cloud. Comport Healthcare Solutions, which really focuses on how we can bring value to our healthcare customers, which is one of the reasons why we're here today. Solutions like Medigate and Aruba ClearPass. And then Comport Secure, which is our cloud solutions that we provide to our customers, both managed and hosted services. And I think one of the unique things that we do as Comport Secure is that we not only focus on solutions that are out in the cloud, we can do managed hosted services for private cloud, and on-premise, we can do managed services for gear that's actually sitting inside of your data center. So we can bring all these things together in one contiguous solution that brings tremendous value to our customers. A little bit about our Comport Secure Cloud, right? So we have customers that are all over the United States. We have three main data centers focused on the East Coast, one down in Atlanta and one out in Las Vegas. So if anybody wants to come visit our data center next time they're in Las Vegas, when we start going to Las Vegas again, we have a great facility there. These are Tier 5 data centers. They're most highly secure data centers that are available out there today. And again, we focus on what our customer needs for a hosted solution, managed solution that spans both what we're doing in those data centers and out into the public cloud, and then also back to our customers' data centers, because most customers still have an on-premise presence that they have to maintain and operate, regardless of if they're moving out to the cloud, which most of our customers are. And one of the great things that we can do is we can provide our customers with either a subscription-based service or capital purchase type of solution. We work with our customers to define what their needs are and then meet those needs. So a little bit about what we're going to talk about today, right? So a lot of things that are going on in healthcare, and cybersecurity obviously is one of the biggest challenges and biggest topics that all of our customers are dealing with today, and specifically around medical devices and what it means to healthcare. So we could talk about, in generalities, what some of our other solutions are doing for things like IoT and cybersecurity, but we're really focusing in today on what the challenges are for our customers in healthcare. Customers are, obviously, all healthcare solutions are dealing with FDA certified solutions, right? Things that can't be touched necessarily. So we find vulnerabilities, but there may be some lag in when we can actually patch those things, or maybe those devices can't be patched ever at all. Those are life support systems, so to speak, that maybe not necessarily can be brought down for patching. And then, so we'll talk a little bit later about what we can do for those things to really protect our environment if we do find a vulnerability that can't be patched right away, because that's the norm, in most healthcare facilities. And we'll talk about sort of the deep visibility into those solutions, into those IoT devices that are specific to the healthcare industry. So Samuel, anything else you want to say about this? So Samuel from Medigate is with us today. He's going to talk a little bit more about the Medigate solution. Anything that you want to add to this before we move on?
Well, I think, Eric, you've really identified the problem so eloquently. Good morning, good afternoon, everybody. My name is Samuel Hill, the Director of Product Marketing with Medigate. And the challenge that a lot of our customers are facing in the healthcare space is really, it's not easy to solve. I mean, let's just be really honest with it. It's difficult. It's complex. We're well aware of all of those things. And so that's why I think Comport is so wise, bringing multiple tools to the problem, because there's not just a single tool. I think the comment on the right under risks, there's no silver bullet that we can use to solve this problem. But at Medigate, the things that we do contribute to the solution of this problem is what we're calling the device security maturity curve. And for us, it starts on the very left with the discovery and profiling of every connected device to your hospital network, the assessment of the risk of those connected devices, the steps you would take to protect those connected devices, and then also the other elements of the network from those connected devices potentially. And then we get into the really mature stages where we begin to monitor those devices and their behavior, and then also optimize the efficiency of some of the efficiencies that these devices can have across the network. There's a lot of people that are involved in this. And I'm grateful that Aruba is here to partner with us and talk about the ways that we would protect, especially on the network side, how we can protect and segment some of this traffic from the connected devices, and protect the connected devices from either malicious or other areas that should not be allowed to talk to it. So with our device security maturity curve, this gives our customers a really great kind of journey and framework that they can look at to see, how am I doing in real time for my connected device strategy. We all know they're not going away. The number of devices is only going to increase and continue to expand as care is delivered in new modalities and new ways and new locations, and the massive transformation that's currently happening in healthcare. So the way that we secure and operate our devices has to catch up and keep up. But there are some challenges with that, as Eric so eloquently mentioned. For Medigate, we're going to start with the discovery and profiling of every single device that's connected to your network. And we do this in a couple of different ways. But first, let's go back to how we had done this before. We've really improved this process where, if you think about it, discovery was based off of an Excel spreadsheet. You're looking at number of devices. Well, I know I have these devices in the network. And this is the spreadsheet that I have. Maybe you've gone and put all of the devices into an ITSM or an ITAM or even a CMDB perhaps, or something to help manage the database of these devices. Yet still, that's not a dynamic resource. So the discovery of devices really is taking a manual process and making it more automated and not real time necessarily, but it keeps it up to date in a consistent and logical fashion. We have partial inventories. Again, well, we think we have this number of mobile devices that our nurses are using, when in reality, the number could be very different than that. Or the low data integrity. You might have this number of mobile devices, but what version are they on? What operating system? What firmware patches have they received? These are all pieces of the data puzzle that can be applied using Medigate's tools. And Medigate does this by using what we call deep packet inspection in a passive manner by looking at the network traffic itself. Medigate has invested heavily in learning the languages of all of these connected devices so that we can actually understand the model, the type, the firmware, the operating system, the unique device characteristics that really bring an incredible amount of data to the system itself. So from before, where it was manual, difficult, partially done, and it had really low data integrity, we're going to go to the Medigate model, which is full device visibility. And we look at all of the different characteristics. We can sit there and say, now, we know the number of connected medical devices. We know what type of device they are. We know who makes them. We know the deeper and deeper levels of details about these devices. Again, we're using deep packet inspection. We're not using AI tools to guess. We're actually looking at the network traffic, parsing it in fine detail, and understanding it with a high degree of confidence. Once we have full device visibility, we can begin to classify these devices by saying, this is where this device belongs. And device classification is a very important step, because without it, you cannot take the next steps that you would need in order to either secure it, to segment it, to apply policy to it, all the different pieces that you need to do in order to have a full security program for your network. So classification becomes the next important step once we've got visibility into the types of devices that are connecting. Once we've classified it, we can begin to assign what we call a dynamic risk score. Every device is not going to receive the same level of risk score, and this risk score can be adjusted based off of your specific organizational need, your risk tolerance level, and the way that you would weight some of the characteristics we look at for the risk score itself. But knowing what the device is with a fine degree of accuracy allows us to really understand the impact radius of that device and the risk of that connected device to your network, to your users, and ultimately actually to your patients. So the dynamic risk scoring changes in fairly near real time based off of current things. Let's say a new vulnerability is published against your specific model of infusion pump, of which you have thousands across your healthcare delivery organization. We would then be able to say, we know this vulnerability is here. This is going to change the risk score significantly, and you're going to see reporting on that as soon as it's available. And we do actually a really fabulous job of making that available to our customers. So the dynamic nature of risk scoring is what's going to feed into the pieces that we really do well with our partners like Aruba and ClearPass. So the reason why we need something like ClearPass is because Medigate is fantastic at discovering the data and the knowledge of what it is that's connected to your environment and your network. But what we do with that data is where we rely on ClearPass. We pass it on in a bidirectional API connection to the ClearPass policy manager for it to take its next steps of automated policy enforcement. And from here, I'll pass it over to Ron Kent with Aruba to talk a little bit more in depth about the Aruba ClearPass policy manager.
All right. Thank you, Samuel. Definitely appreciate that. Again, my name is Ron Kent. I manage security partnerships for Aruba Networks, which is part of Hewlett-Packard Enterprise. First of all, what is ClearPass? ClearPass is a network access control solution that provides visibility, authentication, authorization, and enforcement capabilities for network access. We also provide guest services and integration with a broad portfolio of third-party solutions, such as Medigate. Now, most organizations already have a basic access control system based on Active Directory or something similar. This can define who has access to what files and applications. This basic level of authentication is foundational, but not sufficient to guard the network in today's threat environment. Network access control today must go beyond basic authentication, though, to also include policy-based permissions that take into account a wide variety of security-relevant context. And as the name implies, ClearPass Policy Manager is policy-driven. It can enforce policies based upon things like permissions, who can access what devices, infrastructure, and applications. the device type, whether it's an IoT device, a medical device, a BYOD, or a corporate managed device, and also things like the device location. Are they in or out of the office? What access point are they connecting to? What switch port are they on? And then also additional metadata such as the risk score of the device, things that come from Medigate that tell us deep information about the device that we can use to make a better access control decision. So ClearPass gives IT and the security team the ability to define and enforce who and what devices can access which resources through that policy-based permissions, which can be automatically applied and updated based on their current security status. Now, it's not a static thing. When a device connects to a network, its security posture may change over time. It could get infected, it could get compromised. So those things have to be taken into account as well. And through integration with our trusted partners, you see over here on the left of the slide, we can leverage the expertise of vendors like Medigate, who have a deep understanding of medical devices and can provide the ClearPass policy engine with critical details about medical devices attempted to connect to the network. This information, whether it's the device type, operating system, patch level, security posture, risk score, can be used to determine the exact network access the device needs in a true zero trust fashion. ClearPass then works with the infrastructure, modifying firewall rules if necessary, and notifying other security devices of the presence of this device and what level of access it should have. We'll get into this more later, but Medigate can also provide security-related alerts to ClearPass, so further actions can be taken on the device even after it's connected to the network. This is all enforced by ClearPass using something called dynamic segmentation, which can eliminate the need to manually apply ACLs, VLANs, port configurations, and even things like QoS settings per device, per application, multiplied by the number of role really quickly, especially if you're managing multiple sites and hundreds or thousands of devices. Using a single point of policy enforcement from a central location, IT can provision role-based policies enforced by the infrastructure to ensure that devices like medical devices, security cameras, temperature sensors, and also things like barcode scanners are automatically assigned the right ACLs, VLANs, and other settings, regardless of what port, SSID, or branch it connects into. Using a single point of policy enforcement, you can profile the device and type, dynamically assign policies, and redirect the device's traffic to a security appliance or service for inspection, and then allow traffic to continue or not. For example, if we're talking about an MRI scanner, I know that the role of the device is MRI scanner and not an employee or a laptop. But if the MRI scanner was hijacked in an attempt to access the Epic database, dynamic segmentation would help prevent access to this database using a zero trust mechanism. Authenticating is only one part of being able to control what's on your network, though. Just because a user or a device is authenticated doesn't necessarily mean that it's authorized. And authorizing users and devices is essential and is a key ClearPass strength. And what we mean by authorization is what the user or device is allowed to do or allowed to access. And ClearPass does both authentication and authorization and delivers precise and consistent role-based access privileges that automatically adapts to current circumstances. Now, shown in the slide here, a medical device within a hospital is attempting to connect to the same wireless network as one of the doctor's phones. Because of the context we know about each device, we know that a medical device is attempting to access the network and will get dropped into VLAN 101 with a specific set of privileges on the network. We know it's a medical device because Medigate gives ClearPass that information, along with lots of other details about that device, risk scores, and other things that we can use to make a good access control decision. Now, conversely, the iPhone over there on the right will only have internet access and no access to the network segment where the medical devices reside, even though they're connecting via the same entry point into the network. This is all done via centralized policy and is irrespective of where the user connects from or connects to. So how does ClearPass provide that full end-to-end network security and control? One key way that this happens is through our partner integrations. ClearPass opens its API platform to an extensive ecosystem of over 150 security-based partner integrations so that customers can leverage the investments they've already made in solutions such as Medigate. End-to-end control then means that Aruba is able to blend ClearPass's powerful capabilities with a customer's existing network investments and include best-in-class security applications to maximize value and response for their own unique environment. As Aruba, we recognize that everyone has different solutions installed, and even in the typical enterprise, there are usually numerous vendors represented. The end result is customers who benefit from premium network access control security, optimized ROI on access control, and open flexibility that doesn't force a lockout of other vendors in an Aruba-only solution. The last thing I'll talk about is another part of our integration with Medigate and ClearPass. And these types of integrations also enable you to execute powerful use cases such as this one. For example, a device that's already been deemed healthy and led on the network may become unhealthy later on due to compromise, infection, or another malicious actor, or even like a malicious insider. Medigate is continuously monitoring device behavior, communications, and inter-device relationships. And if anomalous behavior is detected, Medigate triggers an alert, which can then be sent to ClearPass. ClearPass can then take action on the device to immediately quarantine the device or perform any number of other actions. For some device types, you may indeed want to isolate that device from the network to prevent, one infected machine from becoming 1,000. But what about life-saving devices that you may not want to take off the network? How do you handle those? ClearPass has several different mechanisms to handle these ultra-sensitive devices, which can mean anything from simply limiting the device's internet access to prevent command and control activity, dynamically segmenting the network traffic so that it only has access to just what it needs to do its immediate job, or leaving the device as is and opening up a trouble check in the ticketing system of your choice, where the remediation action can be left up to the discretion of the security team. This can all be done via policy and can take into account things like the device type, operating system and patch level, risk score, time of day, location of the device, and so on. This helps ensure that critical life-saving devices that are compromised are addressed quickly, with patient safety as the #1 priority. So with that, I'm going to turn it back over to Eric, who's going to talk more about the benefits of Aruba and Medigate and Comport together.
Yeah, thank you very much. That's great. So, there's a lot of information there. We can see, it's extremely important to understand, obviously, what devices are on your network and have some deep understanding as to what those devices are. Right? This isn't manufacturing. This isn't some other industry. Not to pick on manufacturing, but this isn't another industry where there's generic devices sitting out on the edge of the network that need to be very specific. Healthcare, people's lives are at stake, and it's extremely important to be able to distinguish between an AP, let's say, that's out there on your network versus an infusion pump that's out there on the network, and to be able to understand sort of the where they are in the security spectrum, not only what it means to your environment, but also what kind of firmware, drivers, OS, all those things that are going on inside that device, to understand what the risk profile is, and then to be able to apply policy-based enforcement upon those devices is extremely important. So bringing these two things together is really, really important to creating an overall solution that can really be part of a robust zero trust strategy that customers and organizations want to bring to the table. Zero trust is really big for everybody right now, and is the big shift that's been going on in security. So to sort of bring that all together, right? So bringing Medigate and Aruba together as part of this solution is one of the values that Comport brings to the table, right? But also above and beyond that, to round things out a little bit, right? There is no one particular solution, right? There's no silver bullet. With as far as security is concerned, it's a layered approach to security, right? And security needs to be done in depth. There are other things that can be brought to the table as far as security is concerned on the entire spectrum, and that's really what Comport and Comport Secure focuses on, which is what is good for our customers. What is it that they need, assessing what it is that their needs are and meeting those needs. So bringing things like Aruba and Medigate to the table. Does that mean also, part of the solution is Duo based, right? So if you're looking for a multi-factor authentication as part of that solution, do you need some sort of like user entity behavioral analysis tool, right? So trying to figure out what's normal on my network overall, and if I see anomalies on my network, how do I deal with those? So solutions like Darktrace, those are some things that we can bring to the table. Customers perhaps are looking to bring in backup, or augment what they're doing with backup as part of their security solution, because backup really now has become part of a security solution. So Comport can bring those things to the table as well and bring all these best of breed solutions together and really round out the solution and bring our customers some really high value. So with that, if anyone would like to schedule a security assessment, that's powered by Medigate, please reach out to me. My email address at Comport is here listed. I will get back to anybody really quickly as far as getting that all scheduled. It's really simple. It's really easy to implement, and it's really powerful. You can get really good insights into your environment very quickly. So with that, I will turn it over to David for any questions that we might have out in the on the webinar.
Thanks, Eric. That's a great presentation, and we do have good questions from the audience. Let's start. I think the first one might be for Samuel. It says, "How long will it take to find vulnerabilities once I implement Medigate?"
It's a great question. So once we get the Medigate tool passively sniffing the network traffic, again, using the DPI that we do at the core of your network, we'll start seeing an incredible detail treasure trove, if you will, of all of your connected clinical devices and other things as well. And we can begin reporting on that fairly immediately. When it comes to vulnerabilities, we regularly monitor and publish and share with our customers the current vulnerabilities, the exploits, the different things that are out there and announced by your device manufacturers. So, I mean, I'm assuming all of you have an Alaris IV pump in your hospital. So if there's a new vulnerability announced, that will be notified. You'll be notified of that. It will show up in the Medigate dashboard, and you can begin to take action against it. So how long before you start seeing vulnerabilities? The first step is we're going to see all of the devices you have and profile and classify them so we know which vulnerabilities to report to you. There's a lot out there. Obviously, everybody's well aware of the things. And from a clinical device perspective, knowing which devices are vulnerable to which things allows us to take the right steps. We heard from our customers, at some of our last meetings with them, at our advisory board meeting, actually, they were saying really only about 15% of the vulnerabilities for their clinical devices or medical devices can be patched. The rest have to be segmented. So knowing what the vulnerability is the first step after knowing what your devices are. The first step is to know the vulnerability, and then you can begin taking the steps you need to do that. And that happens fairly quickly.
So here's a follow-on question. It says, Medigate has found some vulnerabilities in my medical devices, but there's either no fix for the issues or it may be a long time before I can patch them. What more can I do with this information to protect my environment?
Yeah, that's why we work with something like ClearPass, because if you can't patch the specific vulnerability to help that device regain an adequate security posture, you have to segment it. You have to isolate it into a low blast radius part of the network where it can do only what it needs to do and have the effect that it only needs to have effect. So that's why we send that information over to ClearPass to say, this is a device with a known vulnerability. There's not a patch for it, or the patch is going to be a long time coming, or the manufacturer won't patch it. Whatever the reason, we don't care. Your network has to remain secure today, right now. So ClearPass will then take the appropriate policy action steps that it needs to make sure that your network remains safe and that your device remains safe.
Okay. a related question, what remediation options do I have to address a compromised medical device?
Yeah, I'll take that one there. So that's primarily a ClearPass question. So it ranges, and it's policy based also. So you as the customer decide what type of action you want to take based upon the type of compromise that's happened, based upon the class of the device that it is, the operating system level, risk score, everything else. That could be as simple as I simply isolate that device off the network and prevent it from getting back on the network. But you may not want to do that with certain device types. So there's gradients of that isolation that can happen. It could be like Samuel was saying, a dynamic segmentation where I just wall off that device from the network to just what it needs to do its job. Or if it's a user device, maybe what I do is I redirect them to a captive portal to where the person can apply some patches or do something else. Or I can be completely passive on the other end and say, I'm not going to do anything to the device, but I'm going to open up a trouble ticket in ServiceNow. I'm going to send notifications via email or whatever mechanism that you want, and integrate within your security analyst playbooks to make sure that they know what's going on with the device. So again, the key here is that it's policy driven, and that you determine what it is, and it's not just an on-off switch. The device is on or off the network, because for most customers, that's just not acceptable. You've got to have flexibility to be able to deal with these types of very sensitive devices. To limit one infected machine from becoming 1,000, but also to making sure that patient safety is the #1 priority.
Great. The next question is, there are other IoT security solutions available. Why is having a context for medical devices important?
Yeah, I'll take that question. So we want to understand, obviously, everything that's touching our network, but we also want to be able to distinguish between, a highly a needed medical device, right, and an iPhone or some other device, a fish tank, right? So believe it or not, there's smart fish tanks out there nowadays. So we want to be able to distinguish between an IV pump and that type of device. And really understand kind of what it's doing, know that it's out there, profile that device, create a risk score, and then make that information actionable. And I think that is really one of the big keys here, is that information is great, but it needs to be actionable. So taking Medigate, looking at the device, categorizing the device, and then potentially passing that off to ClearPass and taking some action, whether it's a passive action or it's an active action, like just walling off that device or shutting down that device. If it's a fish tank, I want to be able to shut down that device. IV pump, maybe not so much. So having that information, understanding the context of that device, and then being able to act upon it is key to any sort of security strategy these days.
Yeah, in addition to fish tanks, Eric, nowadays we're starting to see cars connecting to the network.
Yeah.
Hopefully your guest network, hopefully.
Yes.
The next question is, for compromised devices, how does ClearPass isolate the device? Is this in real time or when the device sends a new authentication?
Yeah, and that could be, again, either. That's policy based. Now, let's address the real time component to that, because real time means different things to different people. But I would say that you have the capability of doing near real time isolation with this joint solution. And why I say that is that when Medigate has detected that something's gone awry with the device, that message is sent over to ClearPass, and then ClearPass can do that change of authorization on the device if you desire, or any number of other actions, and that happens in near real time. Now, what we can also do is check that information at authentication time. So Medigate and ClearPass, even if the device is offline for a while, what we call our endpoint database is synchronized between the two products, so that even at the time of authentication to the network, we can look up the current known state, or the last known state, if you will, of the device, and make an authentication and authorization decision then. And then optionally do, a refresh of that lookup just to see if anything has changed. So policy driven, you determine what happens with what devices, and you can get very close to near real time with the isolation capabilities of the device. And let me also say that isolation, if it does happen, that's done. So that's done. ClearPass works with the infrastructure. We'll go out and touch firewalls and switches and other types of security devices to make sure that if you don't want that device on the network, it is not going to get on the network that's controlled by ClearPass.
Okay.
And to Samuel's previous point, if a car tries to connect to your network, hopefully it's going to a captive portal in ClearPass, right? It's using Aruba's captive portal option, and then asking it to authenticate is just not authenticating on its own.
Okay, the next question is, how do we quantify the risk level before and after a device is segmented?
So that's a great question to be asked, because the risk level is very much determined by your organizational tolerance for risk and the assessment of risk. And so how you go about scoring it is going to be very unique to your organization. Not every healthcare agency has the same ways of assessing risk, even though there are a lot of similarities. So before, we would say, because we know so much about the device, we also know, based off of these third-party integrations, is it enrolled in an MDM? Does it have, how should we apply network policy, like, the different access control lists or different ways of segmenting the network? So your risk measurement might be one state before, where you say, okay, I've identified these issues. There's a vulnerability. We cannot patch it. So therefore, we need to take these recommended steps. Medigate recommends those steps. We say, hey, we know we need to tell ClearPass to enforce these decisions. We know we need to have your inline switch or access point enforce these access control lists. So we can recommend those steps to you. And then after, based off of your risk tolerance and risk assessment, that risk score will change once you begin to implement those things. So, and the other thing I'll say about that, in the Medigate tool, we do what's called a risk simulation, where you can clearly see, hey, so should I, if I did apply this ACL or this DACL to the connecting point of this medical device, how will my risk score change based off of my risk tolerance? And so that's something you can look at and say, I'll know the downstream effect before I actually execute it.
Another question is, what about devices that are only intermittently connected to the network but still need remediation? And what about devices in storage because they're not yet onboarded? Might they still need to be remediated?
That's absolutely. So that gets down into your inventory control question in a sense. So knowing the number of devices you have connected. So we're going to know devices that do connect to the network. It's not that we do communicate with the inventory management tools, whether you're using a ServiceNow or using another type of, in the medical device world, it's called a CMMS. So we integrate with those from Medigate's perspective. We integrate and actually make that data repository, if you will. CMMS is so much more than a data repository, but at a bare explanatory level, that data, the device inventory that exists within the CMMS, we can help turn that into a real-time or dynamic device inventory, so they know, oh, this device has not been connected to the network for 6 months, and perhaps it was actually removed from the device inventory because they didn't think it was in the hospital building anymore. We still know that. We see it when it connects. If it's in storage and hasn't been deployed yet, but yeah, potentially it does need to be remediated. So if that's something you have in the device inventory, we're going to bidirectionally communicate with your device inventory system like a CMMS, and to be able to say, we know you have these devices. We've seen this number of devices on your network and can confirm them, but we know you have this number. So these are all the devices that would need the remediation step.
Great.
Yeah, let me also add there that Medigate and ClearPass will synchronize those databases of devices, even the ones that are offline intermittently there. That way, if one does go to authenticate to the network, we at least have the last known state of that device and can make a decision accordingly to grant or to deny network access.
Here's another question. How does your full device visibility provide maintenance history, device owners' names, warranty, service contracts, in what part of the room the device is located, and for things like an infusion pump, if it's delivering saline or chemo, we're not going to touch or apply access controls to any medical device without knowing those details.
Well, I would first push back on that last statement just a little here, reading that question. We need to apply access controls to every single device that's connecting to the network, and we need to apply an appropriate policy. Now, that policy might be fairly expansive because we don't have key details that we would want to know about a device, but we need to help healthcare security get to the place where every single thing that connects to it is going to be profiled, it's going to have a policy applied to it, and it's going to increase the security posture. The things that we're seeing in the security space for healthcare are just too big and too scary. We have to segment and policy apply to all of these devices. Now, again, that integration with the CMMS systems, the management database systems that healthcare is using to look at all their devices, that's where that integration comes in. So Medigate knows all this information. We report it to the database, and also we report some of that to ClearPass. So it does know those things. It does know details around device version, operating system, patch level, firmware, age, date of acquisition, whether the device is owned by the hospital or leased by the hospital. It knows a lot of these details from the Medigate platform. And because of that, we also know it from the data management platform, the database platform, like a CMMS, for instance. So that information is there. It is available. But at the basic level, we do need to apply policy to everything that connects to the network.
Great. Another person asks, is there any plan to have more real-time uploads of data to Medigate's cloud from the collection appliances? I believe right now it could take 15 to 30 minutes for data to show up in the cloud after being collected on-prem.
I'm going to say I'll follow up with that question asker specifically to handle it. That's getting into our roadmap there that we'll share under NDA.
Okay. Let's see if we have any others here.
This has been such a great discussion too. This is probably one of the best Q&As that I've been a part of. So I want to thank everybody for asking all these great questions.
Yeah, I think maybe we can wrap up there. Unless you see, Samuel, do you see any questions in the Q&A? We have quite a few there, but do you see any more that are urgent for us to address?
Well, I see one on Office 365 for ClearPass. Just a quick answer to that one. Yes, we do support Office 365. In fact, if you go to our website, you'll see we have a very significant partnership with Microsoft, with numerous products from Microsoft. So yes, we can send those emails, based on anything policy related that happens, whether it's a compromised device or failed authentication or anything else that you would want to do that.
Okay, great. Well, before we close, do you guys have any wrap-up comments you want to make?
No, I think it's great questions. I appreciate everybody's time today. I think we've shown the value of bringing, all three partners in this ecosystem together and what each one of us brings to the table to create an entire solution for our customers and for healthcare.
Great. Well, I want to thank all the panelists from Aruba, Comport, and Medigate for their time today, and I want to thank the audience for making today's program possible. And we hope you'll join us for another healthcare innovation webinar soon. So that ends today's program. Thank you very much.
Thank you.